Hey guys, today I want to talk about the side effects of minoxidil and if it's something you should worry about. So if you watched my last video, you already know that I'm experimenting with minoxidil. Minoxidil is a sort of supplement that you can apply on your skin in order to promote hair growth. And I'm using it as an experiment to see if it can also help with beard growth. Now, originally, minoxidil was brought to the market as a medicine, specifically to treat hypertension, high blood pressure. So, what minoxidil does is actually it is a vasodilator, meaning that it opens up your blood vessels so the blood can go through better and therefore lowers your blood pressure. Now, I have been getting some questions about whether people should worry about the side effects of minoxidil. Are there any side effects and are they dangerous? So, a lot of people are using minoxidil mostly for hair on the scalp, but also for beard growth. And most people do not have any noticeable side effects or side effects that they consider so bad that they want to stop. But still, some people experience some side effects. The most common is um, just skin irritation. Could be any form of rash or like a stinging feeling on your skin. Now, usually this is not because of the minoxidil, but actually because of the brand you use. Because a lot of times the minoxidil, which is the compound that is giving the effect, is dissolved in other chemicals such as alcohol or propylene glycol. And those two things, alcohol or propylene glycol, can be irritating for the skin. So if you are experiencing any sort of rash, you can try to get minoxidil foam instead that doesn't contain those two ingredients and see whether that helps with your skin irritation. Another thing you could do is just apply the minoxidil in the morning and 4 hours later just wash your face, put on some moisturizer, let your skin kind of heal a little bit before you put on the second round of minoxidil in the evening. So that's skin rashes. That's really the most common side effect that people experience. A more serious side effect that people experience is heart palpitations, meaning they can really feel their heart beating faster, maybe shortness of breath. And the reason for this is purely because of the vasodilating effect of minoxidil. So, because minoxidil is absorbed by your skin, it gets in your blood, it starts lowering your blood pressure, and to compensate for that, your heart starts beating faster. And it can also give this shortness of breath feeling, maybe chest pain. Now, this sounds very serious, but actually, in most cases, it's harmless, but still, as you can imagine, when you get this feeling, you might be worried. So you should consult with your doctor about this and um, see what your doctor says about it. However, it's not something you should instantly worry about. You're not going to get a heart attack. You're not going to fall dead right away. So don't be too anxious about it. Something you can do in order to prevent this heart palpitations is to minimize the absorption of the minoxidil in your bloodstream. Now, there's a few things you can do. For example, do not apply minoxidil right after you shaved, right after a shower, or right after you did any sort of microneedling. At those moments, your skin is just able to absorb more of what you put on it. So if you put minoxidil at those moments, you're likely going to absorb more of it and it will get into your bloodstream. So as long as you avoid those moments to apply minoxidil, you should minimize the absorption of the minoxidil in the bloodstream and therefore it causing those effects on your blood pressure and heartbeat. Because really what we want is the minoxidil to act locally on your face or on your scalp and not to become systemically become in your bloodstream and start having an effect all over your body. Now, a third side effect that is less well known of minoxidil is that it could possibly increase prolactin. Prolactin is a hormone that in women is associated with the production of breast milk. And in men, if prolactin is very high, it can actually also cause the growth of breast tissue and lactation. This is called gyno. Now, before you think, whoa, that sounds terrible, it's very unlikely that minoxidil is going to raise prolactin in such a high measure that you will see any of those side effects. Nevertheless, it seems that minoxidil is able to increase prolactin, and if you want to mitigate that, there are a few supplements you can take. Vitamin B6 has been shown to reduce prolactin, as well as vitamin E, and also Mucuna Pruriens. This is a bean, and this bean contains dopamine, or the precursor for dopamine. Now, because Mucuna Pruriens seems to lower prolactin, it seems very likely to me that L-Tyrosine is also a supplement that could help lower prolactin, because L-Tyrosine also facilitates an increase in dopamine. So these are really all the side effects of minoxidil that are well known, and as you just heard from my story, none of them are really something you have to be super anxious about instantly. You can just experiment with it, see how you react, and based on which of the side effects you see, you can try to implement some of the solutions I proposed. But many people do not experience any side effects. Me personally, I have not experienced any side effects. No skin rashes, no painful skin, no heart palpitations, no shortness of breath. And I do take L-Tyrosine and vitamin B6 in order to deal with potential increase in prolactin. So I hope that was helpful and it answered any questions you might have had about minoxidil side effects. If you have more questions, if you think I missed something, just drop them down in the comments or contact me on Instagram. The link for that is in my bio. Thank you for watching and see you later.